Good afternoon, everyone. It's a pleasure to share this message with you today at the Insights Learning Forum. Thank you, eHealth Africa, for your partnership and for creating this opportunity to discuss one of the defining public health challenges of our time. I'm Uwimbabazi Sarah, a Uganda Manager for the Margaret Pyke Trust, a UK-based NGO dedicated to advancing integration of climate change, health, and gender equality. We work with governments, partners, and communities to ensure that policies and programs recognize the connections between these issues, helping build healthier, more resilient communities. Today, I am speaking from Ruchiga District, southwestern Uganda. Geographically, Ruchiga District is made up of hills and valleys and a wide coverage of wetlands with communities dispersed across the landscape. Allow me to share a story of Generous, a woman in one of the communities where we work. She is a 35-year-old, married, and has 6 children. 4 of her children are below the age of 10. Her husband, Ernest, is a border rider who works in the city because he thinks he could get more money there. This leaves Generous with the burden of taking care of the home, caring for the children, her mother-in-law, and this is a triple role many women are expected to perform. Her most recent pregnancy was difficult. She felt hot throughout day and night. She never felt like having clothes on and would wear lighter ones only, dressing to cover her body, not for fashion. She developed high blood pressure, but she missed most of her antenatal care appointments due to the long distances, the extreme heat, and managing her responsibilities. Generous has to decide between going to seek health care and working in her farm, as either must be done in early hours before it's too hot. Extreme heat limits how long she can safely work, and changing rainfall patterns have reduced crop yields, mainly beans, potatoes, matoke. At the same time, increased food imports have driven down market prices, making it harder to earn enough for the crops she grows, and her work doesn't stop here. After harvesting, she carries her produce to the market, where she becomes both a farmer and a trader, trying to earn enough money to support her family. By the time she has finished these responsibilities, the health center has often already closed. For Generous, accessing healthcare means losing variable working hours, sacrificing income, or leaving essential household responsibilities behind. Too often, she simply cannot make that choice. Healthcare workers are also affected by the heat. Limited electricity and little or no cooling means the clinic frequently finish earlier in the day, and this is to protect both staff and patients from dangerous temperatures. At Margaret Pyke Trust, we have also had anecdotal reports of increasing miscarriages during periods of extreme heat. While we are yet to conduct our research to understand this further, these observations reinforce what we already know. Pregnancy becomes significantly more difficult as temperatures rise, and we need to understand this further. When we talk about climate change, we often focus on rising temperatures, floods, or droughts. But for women like Generous, climate change is experienced and felt not only by natural disasters, but in the choices she has to make every single day. Women already carry what is often described as triple burden of care. They are expected to care for the children, contribute to household income, and care for elderly or vulnerable family members. These responsibilities place enormous demands on their time, their health, and their economic well-being. Climate change is not only an environmental crisis, but a driver of health and gender inequity. This reality has required us at Margaret Pyke Trust to rethink how we deliver care. Rather than expecting women to travel to health facilities, we bring services closer to them. By adapting services to the realities of climate change, we help women access health care without forcing them to choose between their health and their family's survival. But we need more than adaptation. We also need active prevention. Climate-resilient communities will only exist if we center our communities on solutions that protect and sustain healthy people, healthy families, and healthy communities. Thank you very much for your time.